Wong-Tam. I'm a member of Provincial Parliament for Toronto Centre, and I'm here in Queen's Park with a number of esteemed speakers. We are here to support Bill 42, the Gender Affirming Healthcare Advisory Committee Act. This bill was tabled originally in 2018. It is an NDP bill that is now being tabled again, and hopefully we are going to get it across the finish line this time around. In Ontario, we've seen trans and non-binary people face significant challenges accessing healthcare that is friendly, competent, and affirming. Issues around stigma and discrimination and lengthy wait times have been plaguing the system for those who are trying to access gender-affirming healthcare for some time. We know that we want to reduce the wait times for those who need gender-affirming care. We want to ensure equitable access to this care for every Ontario resident, because healthcare is a human right. We have a number of speakers here, but before I introduce them, I want to acknowledge that we have also MPPs who are joining us today in the media studio. They include Terence Kernahan, Franz Jelinek, who is our health critic for the official opposition, and Jill Andrew. Both Terence and Jill are members of the Ontario NDP Queer Caucus. We are also supported today by a large number of unions representing public service employees right across Ontario, CUPE Ontario, OPSU, OECTA, which is the Ontario English Catholic Teachers Association, and the Ontario Federation of Labour. Speaking first will be JP Hornet, JP is the president of OPSU and has been on the front lines of activism to advance issues of equity in support of women's rights, anti-racism, and decolonization for their entire lives. Following JP, we will be hearing from Abby Rose Fallon. She/her is an educator in the Catholic High School in Guelph, Ontario. She's an active member of her school board's equity committee and also a proud staff facilitator of her school's Gay Straight Alliance. She is also the parent of an 11-year-old trans daughter who is currently accessing trans healthcare in Ontario. Following Abby Rose, we'll be hearing from Susan Gapka. She/her, a trans woman and the chair of CUPE Ontario's Pink Triangle. She has been working towards passing gender-affirming legislation in Ontario for decades. I want to do this for Susan and for all the other trans individuals in Ontario. Please welcome to the podium JP Hornet.
Good morning. Thank you, Kristen. My name is JP Hornick, president of OPSU SEFPO. My pronouns are they, them. When we say that we stand with members of the trans, two-spirit, and gender-diverse communities, we need to action that commitment, and this proposed bill is part of that action. Gender-affirming care is life-saving. We could line the whole of Queen's Park from wall to wall with a list of names belonging to every life lost due to transphobic violence and discriminatory policies. To honor every life lost while unable to access care, and out of respect for the many who have survived to provide testimony today, I won't pretend that it's easy to ask you to place your trust in an institution that hasn't always cared whether we live or whether we die. So today, we are asking all MPPs of every political party to show up for trans, two-spirit, and gender-diverse communities. Excuse me. What we are talking about is life. Access to gender-affirming healthcare is part of what gives life, what makes it bearable, what allows us to actively shape the conditions of our lives, because these are our lives, and because we are precious. Why is this a labor issue? Why is this a workers' issue? Gender-affirming care is a key issue for every worker, for every trade unionist, because when we allow for attacks on one of us, we allow for attacks on all of us. And if we have learned anything from history, it is that when they come for trans people, when they come for 2S LGBTQ communities, trade unionists are next. We are the spaces that are under attack because we are the spaces in which we collectively organize for the betterment of society. So all trade unionists, all of organized labor needs to be called upon to support this bill, to forward these rights, and to center gender-affirming care as a key and important part of our fight for social justice and our fight for workers' rights. Thank you.
Good morning. My name is Abby Rose Fallon, and my experience and my knowledge regarding the importance of fair access to trans healthcare in Ontario comes from two very worthy sources. Firstly, I'm a teacher in a Catholic high school in Guelph, Ontario, and I'm the staff advisor for our Gay Straight Alliance. Secondly, I am the mother of an 11-year-old trans girl. Our family doctor referred us to a local pediatrician who specializes in gender-affirming care for youth and teens. My daughter has been to 4 appointments with this incredible doctor over the past year and a half, and she has been instrumental in our child's journey. It is not lost on me currently that we live in an area where the political climate and the law allow us not only to have access to these services, but that we can do so with little fear of discrimination. It is also not lost on me, though, that my family and I are at the very beginning of our trans healthcare process. And apart from lengthy wait times, we have not been directly burdened by some of the other obstacles that plague members of the community, such as limited OHIP coverage and difficult referral requirements. Working with two-spirit, trans, non-binary, gender-diverse teens every day in my school provides such an education for me. Many of these students are benefiting from trans healthcare, and I get to watch them grow and thrive into their true identities and selves. Many, though, who are not in the position to accept trans healthcare live in stifling, unhealthy, fearful, self-loathing mental states, which to me highlights the necessity of trans healthcare access and availability. Additionally, and of fundamental personal importance, I live with my daughter, and I spend time with her every day, and I know and I understand her deeply. Her doctor is personable, approachable, and is fully committed to providing her and her roster of gender nonconforming patients with the life-saving gender-affirming care that is crucial to their survival and their mental and physical health. Trans healthcare saves lives, and the passing of the Gender Affirming Healthcare Advisory Committee Act is fundamental in addressing the ever-growing needs of this vulnerable population. Thank you.
Good morning, everyone. Thanks for being here today. I am chair of the Pink Triangle QP Ontario Committee, and I'm joined here by Fred Hahn, fabulous supporter, who just is practicing just on time delivery, but feeling supported today. And I'm an out trans person who's working in a leadership position in labor, both in Ontario and nationally with QP National. Our committee works to create safer, fairer workplaces for two-spirit, lesbian, gay, bisexual, trans, queer, and intersex union members. Through political action, like these events today, and key events, we advocate for harassment-free workplaces and communities. And this extends to improving access to quality of public health as it relates to gender-affirming care. Trans, non-binary, gender-diverse people in Ontario have always faced barriers to access to social services, especially health care, which can be central to many of our lives. QP Ontario has a proud tradition of fighting for equity for all members, and as a union, we have led many advances for LGBTQ2S+ rights. For example, in 1998, two of our members, Martine Stonehouse and Andy MacDonald, took the Government of Ontario to the Human Rights Tribunal for delisting gender reassignment surgeries. After a decade-long campaign with political pressure, it was relisted in May 2008. Nonetheless, there remains a serious lack of trans-positive, trans-inclusive, trans-responsive services and supports available across our province. Despite the increasing visibility of trans people and our health concerns, there's a significant gap in trans-positive care for trans people. This Bill 42 is a step forward in addressing these issues, and it is critical that the government, number one, enhance coverage for trans, two-spirit, non-binary, intersex, gender-diverse people in Ontario, expand the range of health care services available, reduce wait times. Where have we heard that before? Adopt informed consent model of transgender care. And lastly, firmly implant gender-affirming care procedures as life-saving and medically necessary. Importantly, this bill requires Gender-Affirming Care Advisory Committee, reflects the diversity of our communities, of trans, two-spirit, non-binary, intersex, diverse communities. And we will put us at the table to inform the government on how best to address our needs. Now, it is in this moment I'd like to think about my friend Julie Berman. She died in 2019 in December after being denied access to treatment for drug dependency, for trans-specific health care. And I have a glitch. When I think of Julie, who died tragically after not being able to access the health care that she needed or the housing that she needed, I just really think that I want to remember that memory of how our community and Julie was beloved. But I also want to work to protect our young and to build a better community for younger trans, gender diverse people and their families. So that's why we're here today. We're often the subject of transphobia, far-right issues, use young people as politics of hate. We want to show that an alternate and provide them with the love, care, and respect that we not only deserve, but we require. Thank you so much today.
Extremely well said, well spoken by all our speakers. Gender-affirming healthcare, as you've heard, is about making sure that we can transform the healthcare system to look at people and try to strive to deliver the very best health and mental health outcomes. It is not simply about medical interventions. That is a part of it, but it is about respecting the individual who walks through the door and having a healthcare system and professionals who will meet their need with compassion and respect. I would like to now open the floor for questions from the media. Thank you very much, everyone, for coming to our press conference. This will conclude our activities for today. We'll be debating the bill at 6 p.m. tonight. For those who are interested in tuning in, obviously you know the channels, either through the Queen's Park Media here, and we'll also be live streaming it on our social channels. Thank you very much.